Good morning and good afternoon. Welcome to everyone. Thank you for your time and welcome to the third in a series of webinars hosted by the MS Society of Canada, featuring specialists sharing information related to MS and COVID-19. Thank you so much for joining us today. We would like to thank Roche and EMD Toronto for financially sponsoring this series of webinars. My name is Benjamin Davis. I'm the Senior Vice President of Mission for the MS Society of Canada, and I'm thrilled that you've made time today to join us. A few housekeeping notes. The webinar is being recorded for future viewing. No participant names or identifying information is being displayed. If you have a question during the presentations, please type them into the chat box on your screen. Questions in both languages will be sent to the moderator, that's me. We will try to get to as many questions as possible, but please note that responses to some common questions regarding MS and COVID-19 will be made available in the near future on our website. Please also note that questions pertaining to specific personal situations cannot typically be adequately answered in this venue, so we recommend contacting your MS health professional. This is an unprecedented time. The MS Society of Canada is closely monitoring information on COVID-19 as released by the Public Health Agency of Canada and other health authorities. The health of the MS community is our priority, and as we manage through concerns related to COVID-19. We at the MS Society of Canada want to ensure you are able to care for your health with the best possible and up-to-date information. To that end, the MS Society of Canada's website has a dedicated COVID-19 page that I strongly recommend you visit for regularly updated information. As you will have noted in the registration, today's webinar features MS specialists in the mental health, physical activity, and nursing fields. The webinar last week featured additional MS nurses, a neurologist, and an infectious disease specialist. If you haven't viewed those already, I recommend visiting the COVID page on our website and clicking on the Hear from the Experts section. Again, it's clicking on the Hear from the Experts section for a link to the recordings. These webinars had a more detailed focus on recommendations related to specific treatments that will be covered today. So I encourage you viewing them if you have any questions about particular disease-modifying therapies. I would now like to welcome and introduce today's specialists, Alexandra Roll, Dr. Katherine Knox, and Dr. Anthony Feinstein. Alexandra Roll will start us off. Alexandra is a nurse practitioner at the St. Michael's Hospital MS Clinic. She attended McMaster University in Hamilton, where she received a Bachelor of Science in Nursing. She then completed her Master's of Nursing at the University of Toronto. Alexandra holds certification in neuroscience nursing from the Canadian Nursing Association, and a neuroscience nursing certificate from George Brown College. Thank you for joining us, Alexandra.
So hi, everyone. I want to thank you for inviting me to speak today. Today, I'll be going over how to prepare for a virtual visit, when to contact the MS clinic or your neurologist office, disease-modifying therapies and required blood work monitoring, and then I'll touch on the precautions to take inside and outside of the home. So to start, to prepare for your virtual appointment, as most of you may already be aware, that all in-person appointments have been canceled due to the COVID-19 virus. However, most neurologists have been offering a virtual or telephone appointment. Here at St. Michael's Hospital, our clericals have been contacting all of our patients with upcoming appointments to offer them a virtual or phone appointment. We're trying to keep them on the same date and time as your appointment would have been. If you choose to decline the options and to wait for the COVID restrictions to be lifted, we want you to be aware that there will be a backlog of patients and to expect a wait time afterwards. I imagine that this would be the same scenario for the community neurologist clinics as well. If you do choose to have a virtual appointment through either telemedicine or a secured Zoom account, you will be receiving an email. You will need to consent to email first before you can receive this. And in another email, you'll receive a link to the actual appointment. So on the date of your appointment, you will click on that and then you will a screen will show up just like this, like today, and you'll be able to see your neurologist on the other end. These appointments will allow the physician to see you and speak to you through your computer, and then they're also able to perform a very limited neurological exam if they need to. So we would say that you want to make sure that your computer is equipped with audio as well as a camera before your appointment. If you don't have these, it's not to worry. You can still have access through your phone so that you can communicate with them through that. If you have concerns about your condition and it can't be managed over the phone or virtually, then the neurologists do have the option to see you in person in the clinic at another date. So when it comes to your appointment date, we want you to choose a quiet space in your home, preferably a location that allows the neurologist to assess your gait if they need to. They can really gauge a lot about your level of disability if they can see you walking. You want to make sure that you are on time for the appointment. And if you are expecting a phone call from the neurologist, the number will likely appear as blocked or unknown. So please answer this. We also want you to take some time to prepare for your appointment beforehand. So we want you to think about how you've been feeling and managing since your last appointment and write it down. A lot of patients do forget when they're sitting in front of their doctor what it is that they've had concerns about. And a lot of the times your appointments have been either 6 months or a year apart. Some of the things that the neurologist will be asking you if you are having symptoms is when they started, how long did it last, were they constant or intermittent, and did they worsen before they improved? So this will help them just gauge whether or not it was a relapse versus a pseudo relapse, or if it was something not related to your MS altogether. It is a bit difficult to assess patients over the phone without actually seeing them. So being prepared with all of the information about your symptoms is really helpful for us. We also want to use this time to discuss your MS, your current medications, and any MS symptoms that you may be experiencing. If there is extra time afterwards, then you can discuss the COVID-19 pandemic. We do want to make sure that we're covering all aspects of your MS first and foremost. Your neurologist will be able to access your medical records or your chart remotely, so don't worry about that. They'll have all of your prior information as well. And then if your MRIs have been done at a hospital that your neurologist does not work at, it may still be available through our provincial site called Connecting Ontario. So you won't need to get a disc or a CD for the neurologist beforehand. Now, if your images aren't available through Connecting Ontario, there is a new platform called Pocket Health that allows you to provide your neurologist with access to your medical images. So most hospitals have signed up with Pocket Health. And if you actually go to their website, you can type in the hospital that you had your MRI at to see if they've signed up. If that hospital is signed up with Pocket Health, you can access your medical images. It does cost $5 to initially sign up, but that is cheaper than the usual fee of $10 when you had to get your CD and bring that in. So if you do sign up with Pocket Health, you will have the ability to actually send your images to the physician before your appointment, so they can have that to view on the day of your appointment. For those that are wondering, we are still accepting new patients during this time. We are currently in the process of arranging virtual appointments with our fellows and the neurologist. We do prefer to see new patients virtually through a camera, so we can at least lay eyes on you. For people for follow-up appointments, a lot of the times your neurologist is familiar with your case and a phone call is sufficient. If your neurologist wants to change your therapies or order any tests, they are still communicating with the nursing staff, and you should expect a phone call from them either the next day after your appointment to discuss the changes that were suggested by your doctor. There may be a little bit of a delay in terms of hearing from the nurses, maybe by a couple of days, so not to worry. And you can always contact the front desk to inquire about what is going on. We are still fully staffed here at St. Michael's, and I imagine that in the community neurologist offices, their secretaries are still answering phones and checking voicemails. So going on to when to contact the clinic or your neurologist's office, specifically to St. Michael's, The clinic is still fully staffed and functioning, while the neurologists are conducting virtual and phone appointments. So if you are experiencing new symptoms related to your MS, we do encourage you to contact the clinic and also to contact your community neurologist office if you're not part of the St. Michael's Clinic. A relapse would be a sudden onset of new symptoms lasting longer than 24 or 48 hours in the absence of an infection. If your symptoms are severe, so for example, if you have a significant weakness, a significant change in your vision with pain on eye movements, difficulty walking that's different from your baseline, and you're unable to reach the clinic or your neurologist's office, then we would advise you to seek urgent care. We want you to be aware that all hospitals are screening everyone who enters the hospital. So we'd say, please check with the hospital website before proceeding to the emergency department and also allow for extra time. Here at St. Michael's Hospital, we are returning relapse phone calls in the clinic within about 24 to 48 hours. For non-urgent calls, it can take up to about 5 days. And imagine it would be a bit timely too in the community neurologist offices as well, since they do only have likely one secretary picking up phone messages. Here in the clinic, we have been overwhelmed with COVID-19 inquiries, and I can imagine the community neurologist offices have been as well. So please, if you do have a general COVID-19 questions, please look online to your local public health website for any answers or contacting public health for any assistance. We do want to reserve the MS clinic nurses time to address MS symptoms and questions about your MS. If you do need your prescription refilled, you can have your pharmacist fax in a refill request. This is usually the route that we go here in the clinic. Normally here, it does take 2 weeks. We do request 2 weeks notice. However, during this time, some neurologists will require more time since they're not physically coming into the hospital on a regular basis. You may also want to speak to your pharmacist because they are able to actually authorize a refill or emergency supply of your medication, especially during this time. They usually just send us a note that they have refilled it. Another option also is to connect with your patient support program, like the MS One-to-One or the Jelenia Go program or the Compass program for assistance. These support nurses that you speak to are always in contact with the clinics or the offices of the community neurologists, and they can notify us of any urgent or time-sensitive matters. We've also here at St. Michael's that we've made arrangements with certain programs to allow them to distribute required blood work requisitions if you've actually run out. Now, if you do need to come into the hospital due to your MS symptoms, we want to make sure that you don't have any of the following symptoms of COVID-19. So fever, a cough, runny nose, a sore throat, severe shortness of breath. We want to make sure that you haven't traveled outside of Canada in the last 14 days. If you do have any of these symptoms, then you do need to notify them as soon as you arrive in the hospital. You will be screened at the entrance. Most hospitals like St. Michael's are actually separating those who answer yes to any of the screening questions to those who have no symptoms of COVID-19. So if you do present to the symptom and are asymptomatic of any symptoms, you will be redirected or escorted to another part of the hospital that is set up as an emergency department where the risk of exposure is less likely. So you won't be sitting beside someone who is a suspected COVID-19 case. For MRI appointments, most of them are all being triaged by our neuroradiologist. So if you are due for a routine MRI, it will likely be canceled and rebooked for a later date. If your neurologist, however, has advised that you attend your MRI appointment, this could be because they are worried about your MS or you've been experiencing new symptoms. So all hospital staff will be wearing personal protective equipment during your appointment if you do need to come in. We still do need to treat and manage your MS. So if we are concerned that your MS is active, we are more worried about that than we are about COVID-19. Everyone is taking the proper precautions if anyone needs to come in to reduce that risk of actually contracting the virus. We would advise that you take all necessary precautions yourself when attending your appointment. So washing your hands often with soap and water, using an alcohol-based hand sanitizer if you can't wash your hands, avoiding close contact at least 6 feet away, especially if you're near somebody who is sick. Avoid touching your eyes, nose, and mouth with unwashed hands, and again, covering your mouth if you're coughing or sneezing. If you do wear your own mask to the hospital, some hospitals are asking you to remove it, and they'll be providing you with a new mask to wear while you're in the hospital. Going on now to your disease-modifying therapy use and the required blood work. So having MS does not increase your risk of COVID-19. Certain factors may increase your risk for complications if you do contract COVID-19, such as chronic medical conditions, restricted mobility, and age greater than 65, and certain disease-modifying therapies. Now, I know this was a topic of discussion last week, so if you do want to review that, then there are those links to review the webinar. So please do not stop taking any of your disease-modifying therapies unless you've been instructed by your neurologist. Stopping some of the therapies suddenly can put you at an increased risk of a relapse. Most of our therapies, as you know, do require blood work monitoring. If you have recently started a new therapy, we would advise to continue with your scheduled blood work. So for example, if you're still within the first 6 months of your Aubagio treatment, we would say continue with your monthly blood work. If you received treatment with Lemtrada less than a year ago, continue with your monthly blood work. If you've been on your therapy for several years and your blood work has been stable, I imagine postponing your blood work would be a possibility. But again, this would need to be discussed with your neurologist. If your blood work has also been abnormal in the past month, we would suggest to continue with your blood work as scheduled so your neurologist can continue to monitor it. Many of our neurologists here at St. Michael's have been basing their decision on postponing blood work on a case-by-case basis, so it is important to touch base with the clinic. You should also follow up with your neurologist before deciding to postpone your blood work, because it is important to note that your prescription renewals are dependent on your blood work. So if your neurologist or nurse is not aware that you're postponing your blood work, there may be a delay in your prescription renewals. If you're still worried about heading out to the labs, we want you to know that most labs are allowing you to make an appointment for your blood work. So consider this option to decrease the amount of time in the waiting room. Lab technicians are wearing full protective equipment for your safety as well as theirs, and they are reducing the number of patients that are allowed in the waiting room at a time. You can also consider contacting your patient support program to inquire about home blood draws. So I know there are certain programs that are assisting in this, where they'll send somebody in to take your blood work, and they'll be right out of your house. You can protect yourself by wearing proper PPE. I'm sure they'll be wearing proper protective equipment, and then you can also sanitize the area once they've left. Life Labs and Dynacare also offer home blood draws as well. They may charge for it. You would have to inquire. It is available all on their website as well about the prices, and if there is any blood requisitions that need to be uploaded before you contact them. So going on to precautions to take inside and outside of the home. Again, MS does not put you at an increased risk of COVID-19. People with underlying lung and heart conditions and those over the age of 60, 65 are more likely to experience complications and become severely ill with COVID-19 virus. This could include many people living with MS, especially those with additional health complications, those with mobility issues, and those taking some of the MS treatments. So all people with MS are advised to pay particular attention to guidelines for reducing the risk of infection with COVID-19. And to take those who do have the extra risks, so other comorbidities, they are asked to take extra care to minimize their exposure to the virus. The World Health Organization does recommend washing your hands, avoid touching your eyes and mouth, which everything that I'm sure you're all aware of. Try to keep 6 feet away, 6 feet between you, yourself, and others, particularly those who are sick. People with MS should avoid public gatherings and crowds, avoid using public transportation when possible, and then using alternative face-to-face routine medical appointments, for example, virtual or telephone appointments. If you do get sick with COVID-19, your MS symptoms may worsen. We know this can happen with any infection, so it is likely the same with COVID-19. If you do need to go to the grocery store or local pharmacy, we advise to contact them beforehand to see if they have protected times like they do for seniors. A lot of them are allowing for vulnerable populations like those who are immunocompromised. You can look into having your medications delivered if possible to avoid that extra trip to the store. And being on a DMT, disease-modifying therapy, may lower your immune system and put you at an increased risk of contracting COVID-19. So just be mindful of that and following proper precautions. Now, when you're in the grocery store, we say to wipe down the handle of your cart or your basket, have a list of things that you're there to get to avoid touching extra things. Maintain your distance from others, and again, don't touch your face with unwashed hands. As soon as you leave that grocery store, try and hand sanitize as quickly as possible. And then returning from the grocery store or having your groceries delivered, if you're able to, make sure to wash your hands before unpacking the groceries. If you want, you can wipe down the boxes or containers. Now, there is conflicting evidence about that. Everywhere you look, somebody will say something different. One thing that they are saying is do not use any cleaning products on your fruits or your vegetables. Once everything is put away, you want to clean any surfaces that you empty the groceries onto, and then again, wash your hands. And then again, proper hand washing before and after you're preparing meals, as well as before and after you're eating. This will also reduce the risk of infection. We also say to disinfect and clean frequently touched surfaces like tables, doorknobs, light switches, countertops, handles, desks, phones, keyboards, toilets, faucets, and sinks. If you have any shared space, make sure that the room has good airflow. So here in the clinic, we try and open our windows frequently just to make sure that the air circulates, since we do still have full staff here. Turn on a fan if possible, just to help with that air circulation as well. If you are living with somebody who is sick, you want to try and have a separate bedroom or bathroom for that person who is sick, if possible. If that's not possible, then making sure that that person who is sick cleans the area after they've used it. If you're the one that's not sick, then we would advise that the person who is sick is the one that is cleaning it. If you are a caregiver for somebody who is ill, provide them with the proper cleaning supplies. And then disinfect every area after each use. So again, just general recommendations for those during the COVID-19 is, again, staying 6 feet away from people, washing your hands frequently, trying to stay healthy, eat a healthy, balanced diet, being physically active, getting enough sleep, and again, managing your stress and worry, which you will hear about shortly from my colleagues about these topics as well. If you do have any concerns, then you can always contact your clinic or your MS neurologist for any questions regarding your MS. But it is good to stay in touch with us and to make sure that you do have an appointment coming up once all of this has passed. And that's everything.
Thank you so much, Alexandra. That is great. Really helpful suggestions and information. Wonderful. And I see that some questions are starting to come in on the chat box. That's great. We will dedicate some time near the end of after our presentations, near the end of our time together for questions and answers. I will say, repeat some of the comments I made at the beginning, that for those of you who have some specific questions related to DMTs, lymphocytes, etc., we did cover those details and topics in the first webinar. So I do encourage you to go to our website and find our website or find those webinars off of the COVID-19 page. Next, I would like to introduce our second speaker, Dr. Katherine Knox. Dr. Knox is an associate professor at the University of Saskatchewan, Department of Physical Medicine and Rehabilitation. Her clinical practice includes neurorehabilitation services with a special interest in MS. She obtained her fellowship training in physical medicine and rehab at the University of Saskatchewan and her Doctor of Medicine and Kinesiology degrees at McMaster University. She is a primary investigator with the CAMCO MS Neuroscience Research Center at the University of Saskatchewan. Her clinical research focuses on gait, exercise behavior, long-term outcomes, and quality of life for people with MS. Thank you for being with us today, Dr. Knox, and over to you. You're
Super.
good.
Hello, everyone. Thank you for having me on your webinar today, and thank you for the introduction, Alexandra. That's a lot of information that will be useful. And I will follow up on the staying active part. So on the staying active part, I will talk about why it is difficult to stay active during a pandemic. It's difficult to stay active living with MS at the best of times. And I will talk about particularly why it might be important to stay active during a pandemic. And finally, some how-tos, how to stay active, a few tips and resources that you may wish to access. So in terms of the barriers for staying active, we know that having a social connection is really important to help us stay active. A lot of us like to be active with another person or part of an exercise class or group. And we also know that having a routine is really helpful for staying active. And during the pandemic, both of these things have been quite severely disrupted. Routines are disrupted, and all your social connections that might have supported you previously to be active on a day when you didn't feel like it. So if you haven't been active and you can't figure out why, despite having perhaps extra time on your hands, the first thing would be to not be upset with yourself that this might in fact be expected. So on the flip side, there is often more time for some people, more time to eat and more time to sleep, which means theoretically there should be more time to dedicate to being active. And during a pandemic, these are my opinions now, of course, because being active during a pandemic is not something that has been studied very thoroughly. But in my opinion, there are three really important reasons to be active during a pandemic. The first, for people living with a neurological progressive condition or with chronic health issues, the most important reason is to maintain function for everyday activities that you like doing. And when we aren't in the middle of a pandemic, you are forced to, take the kids to school or to pick up the grandkids or to go do your groceries. You are forced to move around quite a bit. And during a pandemic, there isn't that need to move around as much. And so very quickly, you may become deconditioned and you may lose some of that function that you had before when you were forced to be fairly active in your communities. We know that if you take all comers with multiple sclerosis, about 20% of people will have a decline in their walking speed over 6 months by about 20%. And we also know that if you intervene with a walking program for people living with multiple sclerosis, their walking endurance and their walking speed improves. So, if you're doing a lot less walking, that could affect your walking function. So it's really important, I think, to stay active to try to maintain that function during the pandemic. The second reason would be to build cardiac and lung reserve or cardiac and lung fitness. We know that people who do experience COVID-19 who have pre-existing cardiac or lung disease have worse outcomes. And so it might be expected that people who have the greatest level of cardiac and lung reserve, the highest levels of fitness, might be able to fight COVID-19 most successfully. And so it is a good time to build up your cardiac and lung reserve. The third reason Dr. Anthony Feinstein is going to speak to in a few minutes is to help decrease anxiety during times of uncertainty. And we know that movement, even gentle movement, not necessarily rigorous physical exercise, is required to help reduce anxiety and stress. So those are three really specific reasons related to the pandemic. In addition to all the regular reasons that we talk about in terms of the benefits of staying active, which I'm not going to talk about today. Most of you already are well informed of those. So that's why it's important. So the next thing is how to. So there has been a boom in online virtual options for exercise, apps and virtual classes. A lot of facilities have moved to providing online classes, whether it be aerobic classes or yoga classes, or different types of structured exercise classes. And one of the questions I know was, which apps are good? Which one should I use? And the problem is there's no one app that's right for each person. So it depends on, what kind of activity level you would like to do with an app. So I would say the best app is the app that you will use. So if it's difficult to log on to, if it's either too boring or too hard, then it's not the right app for you. And there are quite a few products that are charging for their services. I would say that you shouldn't need to pay for a service. There are many online free apps that can be used. Some of them will start free, and then there'll be an option to add more variety or more tracking features. And the truth is, the very simple app that's free is often all that is required. So I don't have a specific app that I would recommend. I think that when you live with, individualized neurologic impairments, it's often the case that you may need to substitute a specific exercise in for something that is more suitable to adapt to your impairment. Then there is the situation for those of you that don't like using the internet or don't have access to the internet. Those of us that would prefer to just go for an outdoor walk in the park. This is, of course, very challenging with social distancing and with parks being closed. And my advice to you would be to find the largest window in your house and turn on some music that you enjoy and do your virtual walk in place. Because it is very difficult to be out in the community at a time when we're not recommending that people do that. And then the other thing that I would recommend in terms of overcoming that barrier of not having that social connection and that peer support to stay physically active would be to reach out to a peer and identify someone that you're going to check in with every day, even for a short amount of time, to share your staying active experiences. The MS Society of Canada has a one-to-one peer support program that a person could access for a virtual walking buddy or a virtual physical activity person. And I think, that peer support is really, really important. So I would encourage people to do that. The amount of exercise or the type of exercise is less important than doing something. There is no amount that is too little. And if you go to the MS Society of Canada and search physical activity, you will see a toolkit and you will find the exercise guidelines. The exercise guidelines for people with mild to moderate MS, adults up to the age of 64, are for twice a week, moderate aerobic activity and strength training of the large muscle groups twice a week. But we must remember that this is not feasible for everybody living with MS. Some people, in fact, might find themselves needing a lot more activity, and others cannot tolerate this much activity. So it really does need to be individualized. I think the other thing to remember is that exercise can be done in any position, and a lot of the online apps and so on are not tailored to people who may not be able to stand or jump or even sit without support. So, exercise can be done in standing, sitting, or lying. And some of the very simple movements are helpful for maintaining the strength and dexterity that are needed for everyday activities of living. So, for example, if I just reach out my hand and we do this for 30 seconds together, very quickly you will feel burning in your forearm. And we know that forearm strength and upper extremity strength is really important, for example, for safely breaking a fall or for regular activities of daily living. So you don't necessarily need to be mobile to be active. And I guess I will put in a plug that we really are feeling the lack of our social and Saskatoon Health Authority programs for people with disability in Saskatchewan, and tomorrow a free active and connected program, NeuroSask, which will involve half an hour of gentle movement in a seated position, followed by a Q&A and connection opportunity for people living with disability. So if you'd like to join us for that, anyone is welcome. And I think we were going to put the registration up in the chat if you're interested, but it's a NeuroSask active and connected. So anyone can find a way to stay moving during the pandemic. If you weren't active before the pandemic, it would be wise to check with your doctor before starting a physical activity program for the first time. Most physicians are offering virtual appointments, and to be cautious about not aggravating previous injuries or creating a new injury by doing an activity repetitively that you might have not done before. So, but in the grand scheme of things, there's usually much more benefit to be had than harm with continuing with some movement. I'll maybe leave it at that, although I don't see Dr. Feinstein on the call yet.
No, it's okay. I see him. Thank you so much, Dr. Knox. I really appreciate your information, and thanks for highlighting a number of particular programs. And for those of you who are inquiring about the NeuroSask, the MS Society will be promoting that through our social media channels as well. I will now throw it over to our final panelist today, Dr. Feinstein. Dr. Feinstein is Professor of Psychiatry at the University of Toronto and runs the Neuropsychiatry program at Sunnybrook Health Sciences Center. His clinical service and research team focus on the neuropsychiatric changes that commonly occur in people with MS, disorder of condition, mood, and behavior. He is the past chair of the Medical Advisory Committee of the MS Society of Canada and has for the past 8 years been the Canadian representative on the Progressive MS Alliance, which is an international consortium of MS societies devoted to enhancing understanding of and developing treatments for people with the progressive forms of the disease. Dr. Feinstein is the author of over 200 peer-reviewed MS publications, numerous MS-related book chapters, and the Clinical Neuropsychiatry of MS, published by the Cambridge University Press and now in its second edition. Among the honors he has received are a Guggenheim Fellowship and a Peabody Award. It's my great pleasure in welcoming Dr. Feinstein to the call today. Nice to see you.
Thanks, Ben, and thank you for that introduction. Hello, everyone. I'm going to speak to you about how to manage your emotional health during the pandemic. I'll speak for about 10 minutes and then be very happy to take questions. It seems to me that the big challenge that we face as a society, and this is certainly true to people with MS during the pandemic, is one of anxiety. There's just an enormous amount of anxiety that is floating around right now. And it's easy to understand why. It's in response to stress. We know that low levels of stress can be quite helpful to people in terms of motivating us to do things. But when you get stress on top of stress on top of stress, like we have now, anxiety levels can ratchet upwards and become very high. One of the big factors that's generating all this anxiety is loss of control. There's so many aspects of our life that we have now lost control over, and this is leaving us feeling uncertain. It creates a lot of stress, and we become anxious. One of the important principles about managing anxiety is to be able to recognize those factors that you cannot control, and we'll go through them just now. Because if you put your emotional energy into this, you can use it up. You can become exhausted. We know that the pandemic has been around for a while. It's going to be here for quite some time. And you've got to marshal your endurance and your stamina in order to help you get through what is likely to be a very long and difficult period. And so focusing on those things that you can't control runs the risk of using up your resources. The basic principle that I'd like to convey to you today relates to putting in place structure and routine. So essential. Planning, structure, routine, and planning. Because by implementing this, you start taking back an element of this control. So in one column, we can list all those things we can't control now. We can't control the infection, the numbers of people who are getting the disease, the mortality rate, the people who are dying from it. We can't control the economic news. We can't control the stock market. We can't control behavior of other people. You know, if we go to a supermarket or we go to a drugstore, we can't manage other people's behavior. For the most part, you know, people are being good citizens, they're obeying social distancing, but occasionally we come across a person whose behavior just doesn't conform to this, and it makes us upset, it can irritate us because potentially it puts other people at risk. So we have to recognize that there are multiple things in our life right now that we cannot control. So make a column of those things we can't control. The risk with that, of course, is we can dwell on this. We slip into what's termed catastrophic thinking, in which we go from one negative thought to another. So we wake up in the morning, we read the bad news about infection rates and mortality rates, and the stock market is tanked, and you know, unemployed numbers are at an unprecedented high, and we get stuck in this pattern of negative or catastrophic thinking, which doesn't do us any good in terms of our emotional health. So be aware of that. And if you find yourself slipping into this pattern, distract yourself. And so, having gone through the things we can't control, let's focus on all those things that we are able to control. Small things, but if you add them up, it makes a significant difference in terms of how we function. So top of my list is sleep. Sleep is really important. Sleep nourishes us. It gives us energy. After a good night's sleep, we wake up refreshed, have a sense of focus and concentration. So we have to attend to sleep. Sleep is also a barometer of our emotional lives. When we become upset, sleep can become disturbed. For example, the anxious person typically has difficulty falling asleep. The anxious person climbs into bed at night and has all these anxious thoughts swirling around in their head, and they can't shut them off, and you can't fall asleep, and you lie awake for hours. Conversely, the person who becomes depressed may want to sleep excessively, too much sleep, or typically you go to bed, you fall asleep okay, but you wake up at around 3 or 4 a.m., the early morning waking, which is so typical of someone with depression, and you cannot get back to sleep. And you lie there in the dark, dreading the day ahead of you. So pay attention to sleep. It can give you clues to your emotions. Remember that your body has a rhythm with respect to sleep. There's a biological rhythm here. So try and go to bed around the same time every night, because you train your body to sleep. You have a sleep-wake cycle. And if you stick to this rhythm, it becomes easier to maintain your sleep. It's very easy during the COVID pandemic, where everything is kind of changing and where the world is upside down, to lose this rhythm. You know, you don't go to bed at your usual time because you don't have to get up at your usual time, and things start slipping out of control this way, and this can play havoc for your sleep. So sleep is very important. Number 2, don't neglect your nutrition. Continue to eat healthily. Don't order in fast foods. Take time over your meals and eat well. Number 3, Dr. Knox has spoken about the importance of exercise. I can just second that. Exercise is very good for you. It's good for you physically. It's good for you emotionally. It's also good for you from a cognitive perspective. So keep exercising. If you haven't exercised before, consider starting exercising now. And she gave you some really useful tips on how to find apps on the internet for exercise. The other important thing for your emotional well-being is that although we have to obey social distancing and we can't go into the office, etc., you must keep contact, social contact with your friends and your family. There was an amusing article the other day saying the good old-fashioned telephone is making a comeback. And it is, so use the telephone. Phone people. Structure your day such that there is time in the day for you to speak to your friends, to your parents, to your children. Maintain these social contacts. They are very good for your emotional health. Also, build in other activities during the day in which you might meditate, or you may listen to music, or you want to go for a walk. So these are the things that give you back structure and give you control. And I would recommend that you write them out, that you create an agenda for yourself each day, that you wake up in the morning, this is the time I'm going to get up, have my breakfast, I'm going to have my shower, I'm going to go for a walk, I'm going to do a bit of work, I'm going to phone a friend, I'm going to do some exercise, but you start putting back the building blocks of your day-to-day activities that are so essential, that are so important. There is one principle that I think is really eloquently and really pithily encapsulated in the following thing: respite as a form of resilience. Let me say that again: respite as a form of resilience. So the respite we refer to here is respite from news of the COVID infection. It's very easy to spend your time looking at the news, dwelling on it, focusing on it to the exclusion of other things. You want respite from that. That's going to build your resilience. And the respite will come from sleeping well, eating well, maintaining telephone contact with family and friends, doing a bit of exercise, if you can, going for a walk, some meditation, listening to music. All those kind of things will be your respite. Remember, of course, that your attention must also focus on things other than the pandemic. I mean, you still have to pay the bills, pay the bills, attend to children, be in touch with parents, manage all those other activities that are part of daily life. And you have to be careful that those don't suffer because you're so focused on infection and how society's changed. Very important that you do these things now, because this will help you build up your stamina and your endurance for the road ahead. I think it's entirely normal for people to feel anxious and a little distressed at this point in time. We can't pathologize that. That's a completely understandable reaction to extraordinary circumstances. So if from time to time you feel a little overwhelmed, stressed, slightly anxious, I'd like to normalize that. I would put it to you that this is how Canadian society feels right now. However, if it gets to a point where symptoms become more prominent, that's when I would recommend reaching out for help. And so there are a couple warning signs over here. For those of you who are still working, if you find that your emotional difficulties are intruding into your work life, if they are impeding your ability to work or reducing your ability to work, that's a potential warning sign to do something. In addition, if you find that your emotional difficulties are intruding into your social activities, if your social relationships are starting to fray, and you find that your emotions are getting in the way of maintaining your good relationships, that's another warning sign. So there are two warning signs for you to look out for. Be careful that your emotions are not affecting the quality of your social relationships. And for those of you who are still working, be careful that your emotions are not getting in your way of you working. If they are, I would recommend that you reach out for assistance, because there are some very good psychological therapies, talk therapies, that can help you with how you feel emotionally. And finally, I'd like to end up by mentioning what one of those therapies is. I'm a big fan of mindfulness therapy. And what mindfulness therapy does is help you deal with your anxiety. Anxious people don't want to confront their anxious thoughts. Sometimes they push them away. You want to blot them out because they're too uncomfortable to think about. The anxious person often can't keep still. You need to move around and do something physically, because by doing it, it distracts you from your anxious thoughts. That kind of avoidance is not a healthy coping strategy. It's far better that you address it head on, and mindfulness helps you do that. So what mindfulness does is, number one, it helps you relax. Very important. You learn how to relax, and there are techniques for that. And then once you're relaxed, in a controlled, stepwise fashion, you introduce your anxious thoughts one by one, and you problem solve around them, and you address them head on, and you solve them. You don't run away from them. And so something like mindfulness is a very effective way of dealing with your worries and your anxieties. And just as with exercise, there's some useful apps online for you to look at mindfulness. Some very good ones. I don't endorse a particular product. Go online, search them, and have a look and see what gels with you. But it's a useful way of tackling some of your emotional difficulties. So those are my principles of management and some thoughts about how to look after your emotional health in the road ahead. I'd be happy to open it up for discussion and take your questions as well. Thanks, Ben.
Thanks, Dr. Feinstein. That's wonderful. And thanks for the information related to sleep and nutrition and exercise. And I wrote down respite as a form of resilience. That's well said. And some of the questions that were starting to come through were related to mindfulness and stress. So you in your talk, you did address some of the questions that were starting to come in. So thank you for that. We do have a few minutes left for questions. I do want to comment that I understand for a brief period of time, the French translation was not happening for technological reasons. Please know that we will go back on the recording and fill in any audio or any translation that has been missed. And for some of you who have been asking again about DMTs and other pieces, those are on the first webinar, and you can access all of our webinars off of our COVID-19 page off of our website. So thank you for those who have submitted questions. One of them I think is for either Dr. Knox or for Dr. Feinstein, and it's a specific question regarding breathing exercises. And in particular, J.K. Rowling, so the author of Harry Potter, has been promoting some particular breathing exercises. And so one of our listeners is wondering as to whether or not those are valid or beneficial in any way. So I don't particularly know what the specific exercise they're referring to, but perhaps Dr. Knox or Dr. Feinstein, you can comment on those. Maybe we'll start with you, Dr. Feinstein.
Yeah, so I'm not aware of what J.K. Rowling is recommending, but certainly the question of breathing is relevant when it comes to anxiety and emotional distress, because what can happen when people become tense and uptight is that the breathing can increase, the rate of breathing can increase, and in its most extreme form, you can hyperventilate, in which you're breathing very rapidly, and when you do that, you can blow off a lot of carbon dioxide and take on board too much oxygen, and you can start developing physical symptoms like a tingling sensation and altered sensation and lightheaded feeling. So you have to be careful of that, and that can be nothing more than a manifestation of anxiety. So breathing and anxiety are very closely linked. I think what J.K. Rowling is probably suggesting is, managing your breathing as a good way of relaxing. And in fact, that's one of the strategies of relaxing. When you look at manuals on how to manage anxiety and panic, there are some very clear guidelines about how to breathe properly, to breathe slowly, to pace your breathing, to count between taking breaths, to slow down your breathing. And what that does is it helps regulate, of course, the pace at which you breathe. And by doing so, you find yourself relaxing. And so I think this is an important point. If you're not feeling anxious, I don't think you particularly have to worry about your breathing. But if you find yourself becoming uptight and anxiety is an issue for you, then paying attention to your breathing can be very helpful. And there are going to be very clear steps about how to do that with mindfulness therapy. You'll find those steps in the apps, etc. I also have a really nice tip sheet that I could send to Ben after this webinar that he could circulate to you. It's the ABC 1, 2, 3 of managing anxiety. And integral to that is how do you control your breathing as well? So it's a very good question.
Wonderful. Thank you very much. Dr. Knox, any additional comments to that particular question or anything else? You're muted. Sorry, Dr. Knox, you're on mute, but I think you said maybe Dr. Feinstein covered it. Is that true?
Well, I would just have one more thing to add.
Okay.
You have to unmute me.
You're on mute. We can hear
Yeah,
you now.
we can
Thank
hear
you.
you.
Okay, yeah, the muting and unmuting is happening at your end.
Oh, okay.
Yeah, so it's okay. No, I think I would completely agree. I guess I'm not familiar with the breathing exercises either that J.K. Rowling is recommending, but I would say that if you feel better after doing them, then they're probably helpful. I think I would also agree that there are a multitude of different apps out there, but there are very few tailored to people who might be paraplegic or might have pre-existing breathing impairments. And so I will just put a plug in that the Spinal Cord Injury and You group are offering free mindfulness and breathing exercises or sessions on Wednesdays weekly, and that's SCI, capital SCI -u.ca. And I just heard from them that they would be happy to have people with MS join them. In particular, I think if you are paraplegic or if you do have some lung disease or restrictions, this session would probably be more geared for you.
Okay, thank you very much. And again, thank you to everyone for providing questions. We're starting to get close to the end of time. There was a question though for Alexandra in terms of, if public gatherings are a challenge. Many of our listeners are still working in, various industries that are required to be, functioning at the moment. Are there considerations? Could you offer some quick considerations around what people can do to protect themselves when they have to work in a retail environment or in a service environment? Can you just comment on that?
So if you are still working, we would say if your workplace does allow it, I'm sure most places are, to wear a mask. Obviously, avoid people who are sick, maintain your distance, wash your hands frequently. Don't touch your face. If you are wearing a mask, be mindful of that if you do touch your mask, that you do need to wash your hands afterwards. And then if you are on a disease-modifying therapy, touch base with your MS neurologist and let them know what your situation is. They may provide you with a note to take some time off of work, or they may also just to add some more tips on how to properly protect yourself if you are on a disease-modifying therapy that would put you at more risk of contracting COVID, or if it would cause more complications if you were to get the virus.
Thank you. Thank you.
I did see somebody ask too if they should stop their medication if they catch COVID-19. I would say not to stop your medication and contact your physician to let them know. I know some of our physicians here are keeping track of anybody who does have COVID-19, just to continue to monitor them as well. We want to be aware of what's happening with our patients if they are sick with COVID-19. Thank
you. And I've been reminded that we do have some extra time set aside for this webinar, so I will make sure we get some of these other questions answered. Again, some of the specific questions of DMTs, we feel those have been addressed in the other webinar. There was a general question, which I'll take actually, relating to questioning whether or not there's been a problem in Canada related to shortage of MS drugs. And what I can say is that that's something that as an organization we are monitoring. And at the moment we haven't heard of a specific situation, but I know that our knowledge network, which I'll speak to as we close, is constantly gathering information that we hear from a provincial perspective. And if you hear of anything as a listener, please communicate this to us as well. We want engagement across the organization, across the country, to make sure that we as an organization can support and advocate wherever possible. So as a community, if you're hearing something related to any particular issue, we certainly want to engage on it as best we can. So thank you for that question. And I will just do one more scan up and down the chat box here, and giving folks another opportunity if there is a question that wasn't answered to ask it. But at first glance, I don't. There was a question around sleep apnea. We did speak to that in the first webinar. But Alexandra, would you comment on sleep apnea and how that relates to MS?
I wouldn't know what I would say. Follow up with your respirologist in terms of any complications related to sleep apnea.
Okay, thank you. Okay, so so let's see. Some folks are asking if we will be answering any questions that were submitted during registration. Yeah, I think we've covered most of those. But if there is a question, Stan, who's on the background here, if there's other questions that we haven't addressed, please put them in. Otherwise, we will follow up and get back to people.
I can address a question that came up. Somebody mentioned that they couldn't access their massage therapist.
Oh, thank you.
And so, that's incredibly disappointing when you found something that works for you and now you can't access it. My recommendation would be to look at other strategies that help with muscle relaxation. One that I would look to would be stretching. There's a great manual specific stretches for people with multiple sclerosis on the National MS Society, put together by physiotherapist Beth Gibson, and you can download the manual. And also the mindfulness training and the breathing exercises may help with muscle relaxation and gentle exercise, as well as heat modalities that are safe. So like those wheat packs that you can put in the microwave where it's very difficult to burn yourself with them, and to apply that to the tight muscle. Those would be some of the things that that person could try.
Very good. We did get another question regarding thoughts on cannabis for both pain relief and mental health. Perhaps Dr. Feinstein, would you comment on that?
Yeah, so thank you. I mean, that's a really interesting question. So my thoughts on cannabis are these. I believe that cannabis CBD potentially has the benefits and the side effects of cannabis are for people with multiple sclerosis, but I think the cannabis CBD option is the safer, more interesting one, because the CBD does not have what we call psychoactive effects. You don't get high from CBD. The aspect of cannabis that potentially might have some problems is the THC component, because that certainly gives you the euphoria, etc. And there's some fairly convincing data from my lab, research funded by the MS Society, I should add, to show that cannabis THC might come with some cognitive difficulties. So you have to be careful of that. That said, if you've tried cannabis in the past and it works for you, that's going to be the most important variable here. So if it helps you and you feel you're deriving benefit from it, that's going to be very important. If you've never tried it before, I would suggest you speak to a cannabis expert. And my recommendation would be to start with the CBD component rather than the THC.
Thank you. And a question for Dr. Knox or for Dr. Feinstein related to clinical trials. Generally speaking, from your perspectives, how has the pandemic impacted clinical trials?
If I could start off with that, I mean, it's had a very major impact. We're involved now with a Canadian-funded study for people with progressive MS. The focus is on cognition primarily, but also on the ability to walk, but primarily cognition. It's a very large study with a very generous budget. It involves Canada, United States, England, Denmark, Italy, and Belgium. It's a 4-year study. We were coming up to the halfway mark, and we essentially had to shut down. We cannot recruit because all the centers have closed. The 4 centers in Italy, all of which were at the center of the pandemic almost. They've all closed. Our center in Toronto has had to close. And so it's had a major impact on our research. Now, the hope, of course, is that we will start it up again once the restrictions lift. So unfortunately, clinical research has taken a very major hit because of the pandemic.
Yeah, thank you.
Yeah.
Dr. Knox, any additional comments?
Yeah, I would have to agree with that. This problem is not specific to MS either. I think it's worldwide. We are seeing less research productivity in the areas that were previously a priority. On the flip side, hopefully we'll see some novel research that comes out of COVID-19 that maybe will be helpful, but it's a huge disappointment to have to stop work that's in progress, especially, and we've experienced that here. So yeah. And I also see that somebody wrote in about the drug shortages, which are also a major issue. Somebody wrote in that they aren't getting 3 months of refills, only one, because there's a drug shortage. This is a major problem. I know in Saskatchewan, my colleague, Dr. Evans, mentioned yesterday that they have about 200 drugs with drug shortages, and they're working to deliver alternatives to people who can't get their drugs due to drug shortages. MedSask is working on what's the best alternative a person could access. So yeah, I'm sorry about your refill challenge, and this is a worldwide impact of COVID-19, drug shortages and lack of research being stopped.
Absolutely. Thank you. Alexandra, any comments from your perspective?
No, but that was great.
Thank you. Thank you. There was a question around statistics related to people with MS and COVID and remission. My understanding is that, the data is just starting to be gathered, right? There's a global movement to gather data. My answer would be, I think it's perhaps too soon to start to understand the full picture, but perhaps are others having an opinion on the data and as it relates to COVID and people with MS?
I know that the data is being collected now. Many different groups are collecting COVID-related, MS-related COVID data. It's too soon to I think comment on it, but many groups are doing it worldwide.
Yeah. Thank you.
I think I guess I would just say that as time goes by, I'm more reassured by the data than less reassured. So I think the numbers are upwards of 500 people with MS internationally now having contacted COVID-19. And for the most part, I think people have come out of it quite well. Last I heard, there was a very low number of deaths. So perhaps even lower than the expected rate of death. So it's impossible to know. There isn't enough data, but the data we do have is not, it's certainly not increasing my anxiety level. If anything, I feel that, I don't think people with MS are more vulnerable than people with advanced heart disease or advanced lung disease, which clearly has shown to be not a good prognostic thing to have if you do contact COVID-19.
All right, thank you. Thank you. There was a comment that's saying, we're telling everyone with MS on DMT to contact their neurologist for general questions on additional precautions. What can you tell us about COVID-19 and DMT? So if I'm interpreting the question, I would say two things. One, the first webinar we did dove deep into DMTs and MS with lots of information from neurologists. So I would encourage this particular listener to go to that site. And the second thing I would say is that our webpage is being updated regularly with current and relevant information. And when I close, I'll also share some details around our knowledge network, which is an incredibly important resource, which is gathering information on a daily basis to help people with MS. So there's lots of ways to get current information. And again, some of these other questions I think would be addressed in a previous webinar. So I think we'll close. I want to thank absolutely everyone for taking their time today to listen in. I want to thank our specialists for your time, for providing well-prepared and detailed information that we will use today, and we will recycle and reuse this webinar for many times to come. So it's really, truly greatly appreciated. I want to thank Roche and EMD Serona for helping support this work that we're doing. And if Stan, if you can put the final slides up, we'll close with some remarks. So as we close off, I want to remind you about the MS Society of Canada's Knowledge Network, which is staffed by trained navigators to answer questions related to MS, including MS and COVID-19. They provide consistent, quality information and support, and you can see on the slide how to connect with them through phone, email, and live chat. Finally, as you may know or can imagine, the MS Society of Canada has had to shift how we are connecting our MS community, and of course, connecting is now more important than ever. I encourage you all to visit www.wechallengems.ca to learn about a new nationwide movement to virtually challenge MS together as we approach MS Awareness Month in May. A final reminder that you'll be receiving a survey following this webinar, and I encourage you to fill it out to let us know if this information was valuable to you and what other topics you would like to see covered. We absolutely intend to do more of these webinars going forward. Please remember the recordings of all of our recent MS and COVID-19 webinars are available through our COVID-19 section. I think I said that a few times today, and on our website and on our YouTube site as well. Again, thank you to our speakers and to all of you for participating in today's webinar. I really appreciate your time, and I hope everyone is doing well. So thank you so much.
Thank you.
Thank you.
Bye-bye, Ben.